Welcome to the workshop. This workshop is going to be on gender responsive training to frontline animal health workers, hosted by the Livestock Data for Decisions Network and the Food and Agriculture Organization of the United Nations project that's called Empowering Veterinary Paraprofessional Entrepreneurs. My name's Julie Kaler. I'm head of gender for SEBI Livestock based at the University of Edinburgh. SEBI Livestock is the organization that encompasses the Livestock Data for Decisions Network. So a few technical things before we begin. We are recording the meeting. We will publish the recording on our YouTube channel afterwards and send a link to everybody who is present here. So please be aware of that. The Q&A function is open. Post all your questions and comments into the Q&A function. You'll find that Q&A button on the Teams toolbar. Simply click the button, post your question. We have asked all the speakers to try to pay attention to that Q&A section and answer the questions throughout to the best of their abilities. And then we will pull some into actual Q&A portions of our presentation. So today we're going to explore the amazing resources that have emerged from the programming undertaken by FAO and their partners to build gender responsive frontline animal health workers. There is absolutely a growing interest to understand how training for animal health workers can better address women's needs and improve outreach to women's farmers. In this session, we're really going to highlight the role of data, qualitative inquiry, and multidisciplinary collaboration to identify those barriers, shaping training methodologies and informing adaptations through that process. The FAO VPP program, as it's called, has generated a set of complementary products focused on strengthening gender responsiveness in animal health training and service delivery. And so that suite of tools includes a published lessons learned paper on making training for animal health workers responsive to women's needs, a toolkit on mainstreaming gender for frontline workers that includes a training manual and a lot of downloadable resources on how do you really support outreach to women farmers, and a teaching tips paper, and that's being prepared for submission to a veterinary education journal. And it's really going to provide that kind of concise guidance for working with service providers and addressing gender at a farm level. In this session, we really hope to do multiple different things. So we hope to share the lessons from FAO's programs. We really want to present that evidence base and the needs assessment process and methodology that informed the development of the training approach, introduce this suite of products that is starting to emerge out of this work, and show how service provider level and farmer level gender approaches really can be linked in a very practical, very coherent way and very inclusive way. We also hope to really demonstrate how the tools and materials can be adapted using context-specific evidence, right? So we've got a whole second section that really is a process of working together to do some of those adaptations or potential adaptations. And we wanted to do this all with the goal to create a space for peer exchange among veterinary paraprofessionals, country teams, training partners, others interested in applying this approach to your work. So we're excited that you all have decided to join us today. So a key lesson from this work is that gender responsive training cannot be developed as a one-size-fits-all package. It has to be based on evidence about the realities that are facing women farmers and service providers, and it must be adaptable to different operational, social, regional contexts. This workshop really is about place particular emphasis on the role of data. We want to emphasize how we use data in that context, specifying process to make it relevant. Both data used to identify the issues and build the initial model, and the additional qualitative and contextual data needed to adapt the materials in these settings. So all that being said, I'd love to invite a special guest to open our session. Mohammed Shamsuddin is the Senior Animal Production and Health Officer for FAO's Regional Office for Africa. And we'd like to invite Mohammed on his vacation to open our session for you. Over to you, Mohammed.
Thank you so much, Ms. Julie Kaler. fellow participants, greetings from Accra, Ghana, where the FAO Regional Office for Africa is, and a very good afternoon. I thank the organizer to invite me and give me this opportunity to share a few words with you on behalf of the FAO Regional Office for Africa. And I take this opportunity to welcome you all to this webinar. Let me begin by a few words. Thank you to Julie again for setting an excellent scene and giving a very clear picture what will be today's discussion. And in line with that, one can never overemphasize the importance of access to and the quality of animal health services. The services that is fundamental and required to protect our animals, the farmers' investment, the capital assets that the value chain actors mobilize along the livestock value chain, as well as the public health, especially when it concerns the foodborne disease, zoonosis, and antimicrobial resistance. The livestock, as we all know, it is the driver for macroeconomy, especially the rural economy in many countries all over the world, and especially in sub-Saharan Africa. Having said that, yet for many, access to these very required animal health services are limited. And if we look at especially to the rural areas, for the women, for the smallholder farmers, for youths, I will come to that, and especially other marginalized community. For FAO recognizes that women play a central role in livestock production. And this is why FAO has identified inclusivity as a strategic, as a cross-cutting agenda along its strategic framework 2022-31, which we are delivering by what we call the 4 betters: the better production, better environment, better nutrition, better life, and leaving no one behind. That's where it comes, all the importance on the inclusivity. Now, having said that, there are unique challenges that the women, youth, as well as the smallholder faces. Let me highlight a few of them. It's a long list. I'm not going to be exhaustive. And number one is the access to services. Because the women and the youth and the smallholder, they often don't have the bargain power. They ask for a small stock to serve, to treat the animals, and especially when it comes to the preventive veterinary medicine. Access to finance is another issue because they do not have the collateral. You will agree with me, only a very few, if not none, of the women in the rural area has the bank account to go for a collateral, to pay bills in the let's say mobile money or with the credit card. Digital device, it just come, as I already mentioned. Only a very few women will have the smartphone to really pay bills, to request for the service, to go into the social media. And on top, in many communities, in many cultures, there is even social taboo for women to be on the social media. And let me also share with you my quite a long experience of a practicing veterinarian. Many social barriers and the prevailing culture don't allow women to don't feel comfortable to talk to male veterinarians, especially when it comes to the reproductive disease of the animals and breeding and etc. So this is where it comes that we should not only target women as a beneficiary, we should also have women as a service veterinarian. I know in the veterinary professional we have a lot, but when it comes to the front line, especially the para-veterinarian, we need more on there. We must address this issue as now, I would say, to build a more inclusive and resilient livestock system. As I already mentioned, the veterinary paraprofessionals play a significant role in delivering animal health services as well as the input providers. For example, like the feeds, the fodder seeds, vitamin mineral premixes, the farm equipment. These are all needed. Every farmer needs them in the corner, and they are the one who can mobilize it. It is important that women, as I already mentioned, are also the veterinary paraprofessionals, service provider, not only the service receiver. FAO has been supporting the roles of private sector veterinary paraprofessional through its empowering veterinary professional entrepreneurship project, which has been implemented in good number of countries in sub-Saharan Africa, in Nigeria, in South Africa, in Sudan. The project has aimed to strengthen the preventive and healthcare and the business capacity of the veterinary paraprofessional, while we are working to improve their regulatory and business environment using an One Health approach. Ladies and gentlemen, we'll be sharing the key lessons from this project, and especially that the training and service delivery must be gender responsive, grounded in the evidence and adopted. And I must emphasize again, though we must not think that we have included women, we must listen to the women before we plan even our training. That's very important. Time doesn't allow. I could bring many examples how it is important. So, ladies and gentlemen, today's workshop is to explore this issue more in depth and sharing the evidence, methods, and protocols. And I warmly welcome you to participate actively to the exchange. And I thank you again to listening to me, and thank to the organizer. And I would also like to be excused. I would like to be on the whole day, on the whole time, but unfortunately, because of some other commitment, I may have to log off after a while. Thank you so much, and I give the floor back to Mr. Julie. Julie, over to you.
Thank you so much, Mohammed. Really appreciate your words and your call to action for us all to really do the hard work, but the meaningful work of making sure women are included in the process. So it is time for us to get rolling on figuring out what is this program, why does it matter, and then how can we take the resources that this program has created and the tools and really adapt them for ourselves. So I'd like to introduce Emma Alegi, who's the gender specialist in FAO's Animal Production and Health Division, or one of the gender specialists. And she's going to really be talking to us about why gender responsive training for frontline animal health workers matters. Just a reminder, post your questions, your comments in the chat, and teams are standing by to answer those for you. Over to you, Emma.
Hi, everybody. Thank you very much for joining today's webinar. I'd like to start by giving you a bit of background to the work that we've been doing regarding strengthening private sector veterinary paraprofessionals businesses and clarifying who veterinary paraprofessionals or VPPs are. Quality preventive livestock healthcare is crucial for farmers' animals to be sustainably productive. Yet across sub-Saharan Africa, veterinarians are few, and public veterinary services have increasingly focused on disease surveillance and control, leaving a real gap in livestock healthcare for smallholder and pastoralist farmers. Private sector VPPs can help fill this gap. Unlike community animal health workers, VPPs have a technical level training, anywhere from a 2-year certificate to a full degree, depending on the country. And crucially, they vastly outnumber vets 10 to 1 across sub-Saharan Africa, and even higher in rural areas. So they're on the ground close to the farmers and can be their first point of contact. But many struggle: gaps in training, limited mentorship and support, weak regulation, competition from unqualified providers or so-called quacks, and as we'll explore today, a strong gender dimension that further compounds these challenges. FAO has been working to change this, piloting a model to empower private sector VPPs to build sustainable businesses around preventive livestock healthcare, and in doing so, increase outreach to the farmers who need it the most. The project's been implemented in 2 phases between 2020 and 2026 in 3 pilot countries: Uganda, Nigeria, and South Africa. The overall objective is improved livestock farmer access to quality preventive healthcare services through private sector VPPs. And the initiative has 4 key outcomes. The first is locally led training courses for private sector VPPs, so not initial training, but continuing professional development centered around preventive livestock healthcare. And this is co-created and delivered in partnership with training institutes at the local level. The second is improved regulation and recognition of VPPs. So strengthening the regulatory environment so that qualified VPPs are formally registered, recognized, and able to compete on a level playing field, including developing national competency frameworks tailored to each country's legal and professional context, and in collaboration with the national veterinary statutory bodies. The third is the development of a supportive business environment, so establishing multi-stakeholder platforms at national and local levels, bringing together farmers, government, private sector, and financial institutions to identify barriers to VPP business sustainability and develop homegrown solutions that can help strengthen last mile animal health service delivery. And the fourth is impact assessment and communication of findings, so capturing and sharing lessons learned to inform future VPP training and policy at national and regional levels. So how does gender responsiveness fit into all of this? Women are estimated to constitute between 20 and 30% of the animal health workforce across sub-Saharan Africa. They're a very crucial channel for reaching women farmers, particularly in contexts where seclusion norms mean that women may only interact with or receive services from other women. But they face many gender-based disadvantages in the workplace, such as bias from clients, harassment, receiving lower remuneration for equal work, and care burdens, just to name a few examples. And despite gradual increases in the profession, many still opt for roles based in labs or clinics rather than field work, or drop out of the profession altogether, further widening the gap in service access in rural areas. At the farmer level, women play a crucial role in daily animal care and family health. And this means that they are well positioned to implement best practices as well as detect irregularities or disease symptoms early on. But the issue is that they're too often underserved by veterinary services and extension. So despite estimates that women constitute the majority of low-income livestock keepers, it's also estimated that only about 5% of agriculture extension, including veterinary services, effectively reaches women farmers. And this gender gap in access to information ultimately creates weak links in local animal health systems. And addressing these issues isn't just a question about advancing gender equity. It has very direct practical implications on on the effectiveness of animal health service delivery and ultimately the productivity of farmers. And so these gaps led us to ask ourselves questions that ultimately shape the design of our training. So how can we design a training that addresses these gender gaps? How can we better reach and serve women livestock keepers? And how can we professionally empower VPPs and especially women VPPs? So these three questions will thread through the lessons that we'll share with you today. To explain what we mean by gender responsive training, it helps to think about gender mainstreaming across a continuum. So at the one end, training can be gender unaware, so assuming women and men participate in and benefit from training in the same ways. But we know that's not always the case. Access, mobility, digital access and literacy, time availability and domestic responsibilities, as well as learning needs, are likely to differ by gender, and gender-neutral training designs can therefore unintentionally reinforce existing inequalities rather than address them. Our CPD, so Continuing Professional Development model, sits primarily in the gender-responsive space, meaning we actively adapted training design and delivery to recognize and address those gender-differentiated constraints. That said, some elements of our work crosses into gender transformative approaches, which go one step further and seek to shift the underlying norms and power relations that drive gender inequalities. And we'll touch more on that later in today's session. So before diving into how we developed the gender responsive elements, I'll briefly outline the overall training model. So the objective is twofold: to support VPPs in running thriving and sustainable private sector businesses while providing quality preventive livestock healthcare services to farmers. The model has three core components: self-paced modular online learning, complemented by practical workshops to build hands-on experience, and a mentoring scheme offering individual guidance and support that many VPPs lack, as well as strengthening the collaboration between the vet and VPP profession. For the next part of the presentation, I'd like to give the floor to my colleague, Shehu Shamsuddin, who will share insights on our needs assessment process, which informed the design of our gender responsive model. Over to you, Shehu.
Thank you very much, Emma, for that very good background of where we're coming from and what informed the design of the project. We did not just, jump into designing, gender responsive training, but we actually went to the field to talk and listen to VPPs, to farmers and other stakeholders, so we understand better how best to design such, training. Next slide. So why did we do this? It was to ensure that whatever we're designing is evidence-based and based on what is being demanded for at the end of the farmers themselves, but also the VPPs who are the service providers. We also were able to get gender disaggregated data because we realized that not disaggregating data could mean that some insight will be hidden and we would not be able to then design for specific needs of women and men VPPs. We also, wanted to consider context-specific findings so that local solutions will be tailored for local challenges or local problems. In this case, training needs. We also had to establish a baseline so we would be able to measure changes that would eventually occur as a result of our intervention. Next slide. So we asked ourselves wanted to ask three important questions. What is the business environment for VPPs and what are some of the challenges that men and women VPPs are facing in terms of running sustainable businesses, including also gender barriers where necessary. We looked at prioritizing what skills sets that needed to be built for VPPs based on demand from farmers and not just, generic, design of topics. Of course, we also wanted to understand how VPPs will be able to learn best, what time suits their learning, what kind of learning modality is it, blended learning or online only learning, and also most importantly, the flexibility around, how to get this learning. Next slide. So we kind of used the mixed approach to try to understand this and build evidence. We consulted literature of existing, evidences of gender in veterinary domain to further understand the issue at hand. We conducted also telephone survey of 450 VPPs across the 3 countries with data disaggregation, as mentioned earlier. We went ahead to do focus group discussions with 247 VPPs across 3 countries. And where possible, we had separate, meetings for separate genders. And then finally, we conducted key informant interviews with stakeholders such as farmers, pastoral communities, agro-pastoral and peri-urban settings to also be able to understand better what kind of services they would need from VPPs that then would inform the kind of training content that we would design for VPPs. At the end, we triangulated all of this to be able to synthesize insights that inform the design. For key gender, responsive, we're deliberate about gender responsiveness in even, the constitution of the research team, in also using gender analysts, in also intentional recruitment of women and men as key informants to counter underrepresentation. We had separate FGDs where possible to create safe space. And all of these data were disaggregated by sex and by gender. So thank you very much. I'd like to stop here and pass it over. Thank you.
So we're going to invite Emma again.
In this next section. Thank you, Shehu. In this next section, together with my colleagues, we'd like to walk you through how findings. So the first insights relate to Thank you, Shehu. In this next section, together with my colleagues, we'd like to walk you through how findings from the needs assessment directly inform. So the first insights relate to finding eligible women and men trainees. So ensuring that our recruitment strategy was effective in achieving gender balance among selected participants. So the needs assessment made clear that low baseline representation of women in the VPP profession was only part of the challenge. Women were also less visible in formal networks, associations, and veterinary statutory body registries, typically used to advertise training opportunities. We also found that women and rural VPPs faced greater barriers to digital access, so relying on online-based advertisements alone would have systematically disadvantaged them from the onset. So to overcome these challenges, we adapted our recruitment strategy. We introduced a minimum gender quota of 40% women, and made sure women were visibly represented and encouraged to apply in all training advertisement materials. We also made the training application accessible via smartphone and combined digital with offline dissemination channels, sharing the opportunity through informal networks like WhatsApp, as well as printing flyers and posters for distribution in communities. Additionally, we requested relevant stakeholders to actively nominate women VPP candidates, who we then contacted directly as FAO, encouraging them to apply, and asked them in turn to nominate further women candidates, so creating a so-called snowball effect. The pie chart shows the applications we received by gender in each country. Orange represents women applicants and blue represents men. The bar chart on the bottom half of the slide then shows in orange the gender quota we established, striving for a minimum of 40% representation of women, and in green the proportion of women participants effectively selected in each country. So we exceeded our 40% quota in South Africa, we met it in Nigeria, but fell short in Uganda, where only 26% of participants were women. However, the number of women we selected mirrored the proportion of women applying. So what were the key takeaways from this recruitment experience? First, as we just saw, the number of women participants closely mirrored the proportion of women who applied. So really reinforcing that well-designed recruitment strategies are crucial if we want to improve the number of women trainees. Second, the gender quota can be a very useful planning tool. It can encourage proactive outreach and create accountability, but quotas require clear eligibility to ensure that you're selecting the right target group and not just ticking a box for the sake of satisfying a numerical target. And what we found is that without this, there's a real risk of prioritizing numbers over selecting individuals with the intended professional profile, which ultimately can have the unintended effect of undermining the professional credibility of women participants. But we'll be discussing this in more detail later in the presentation. The second area we'd like to cover is learning modalities. So the needs assessment gave us important insights into how VPPs learn best and what barriers they face in accessing training, and this directly informed how we designed and delivered the online learning and face-to-face workshops to be more gender responsive. The needs assessment revealed two key findings that shaped how we designed the learning modalities for the online learning. First, significant gender gaps in computer access and internet connectivity across all three countries. This is represented in the bar charts. The needs assessment revealed two key findings that shaped how we designed the learning modalities for the online learning. First, significant gender gaps in computer access and internet connectivity across all three countries. This is represented in the bar charts. The needs assessment revealed two key findings that shaped how we designed the learning modalities for the online learning. First, significant gender gaps in computer access and internet connectivity across all three countries. This is represented in the bar charts. Blue represents women's access and ownership, and orange represents men's, and those yellow bubbles represent the gender gap. And it's worth noting that this data was collected as part of our quantitative assessment through a telephone survey, specifically to avoid biasing results by assessing technological access through a digital platform. And as you can see, there are gender gaps in internet access and computer ownership. However, smartphone ownership is comparatively high across all three countries with almost no gender gap. The second finding was that lower confidence and experience with digital learning platforms among women and rural VPPs in particular. So in response to ensure accessibility, we designed the online learning to be smartphone and offline compatible, so that participants could complete interactive modules from their phones, even without internet connectivity, and then upload their results once connection was available. Small data subsidies were also provided to all trainees. The content itself was designed to be simple, concise, and modular, with interactive elements including quizzes, videos, discussion forums, webinars, and WhatsApp peer support communities to build digital confidence. And crucially, during the first practical workshop, we provided face-to-face onboarding to FAO's Virtual Learning Center platform, ensuring hands-on support for what were, for most participants, entirely new digital tools. We also made adaptations to the face-to-face training, and we'll be sharing more about those in session 2 of today's webinar. Moving on to the third area, curriculum design. So specifically how the needs assessment helped us identify gendered learning needs and how these informed the curriculum design of the training. So to identify gaps in VPP training and demand, we used a mixed methods approach. We started with curriculum mapping, analyzing existing training content in terms of topics covered and the balance between practical and theoretical components. We then used surveys and focus group discussions with VPPs to identify their own priorities for further training. Focus groups with farmers to understand where they wanted VPPs to strengthen their skills or expand their services, and then key informant interviews with vets. We then brought all of this together into a gaps and demand matrix, sort of mapping the findings by topic, by stakeholder group, and then by whether it represented a skills gap, a demand from farmers, or both. So for example, herd health planning emerged as a priority topic across both VPPs and livestock keepers. Nutrition and reproduction showed strong demand from farmers in particular. There was also considerable variation across the 3 countries, so the matrix is a high-level summary. So this slide shows data from the Uganda telephone survey as part of our quantitative analysis, and it shows topics for CPD training according to priority. So on the right in dark green, you can see the aggregate results, so topics listed in order of priority, with animal production and economics, infectious disease prevention, herd health planning, and business skills coming out on top. And these results notably largely reflect men's priorities, given that men made up the majority of respondents. But when we disaggregate by gender, shown on the left, with women in blue and men in orange, quite a different picture emerges. Women's top priorities were business skills, communication and extension, animal production and economics, and notably artificial insemination also featured highly for women, but not as high for men. And this is really why sex disaggregated data matters. Had we relied on the aggregate data alone, these distinct learning priorities would have been invisible, and we would have designed a curriculum that didn't fully reflect or address the distinct learning needs of women VPPs. The needs assessment revealed 2 important qualitative findings that shaped how we adapted curriculum content. The first was that women VPPs face specific professional barriers in the field, clients questioning their competence, reports of lower pay for equal work, sexual harassment, and bias. In response to this, we added online modules on recognizing and responding to gender-based professional challenges, and during face-to-face workshops introduced role-play exercises where trainees could practice de-escalating situations of conflict and addressing challenging workplace scenarios. The second finding was that gender-based professional disadvantages are reinforced by broader workplace and community norms, and therefore can't be addressed through women-only interventions alone. Women really need the buy-in and support of male allies in order to shift harmful perceptions. So we integrated a positive masculinities approach into the curriculum, actively engaging male VPPs and trainers to reflect on gender-based professional challenges and collaborate on finding tailored solutions. So this is where our work began to move beyond gender-responsive approaches into gender-transformative territory, recognizing that professionally empowering women is necessary but not sufficient. Lasting change really requires a mindset shift amongst men too. And I'd now like to invite Dr. Fatima, Mohammed, and Grace Nakitu to tell us more about curriculum adaptations.
Thank you, Emma. In parts of Kaduna, there's this seclusion now where women are not allowed to get in contact with men. In some houses, you find out written boldly in front of the houses. In Hausa, you see it written ba shiga, meaning no entry. So this interaction, this norm made it hard for women farmers to get veterinary services. But also it's a unique opportunity for female VPPs. We adapted this in a role play activity to reflect the realities participants face in the field. On how we made a role play on how they experience differently in their communities, how they are female VPPs are shortchanged, and how male VPPs don't get to render their services to female farmers. So in this role play, they all acted their personal experiences, and we sat and brainstormed on how to overcome these challenges. On your screen, you can see a male VPP trying to explain. And so we brainstormed and created a scenario. In this picture, you see the female VPP hold on to her male counterpart to accompany her to a community where she's not allowed to, or they look down on her, because most of the female VPPs explain that they don't get to render their services because people look down on them because of their gender, as they cannot handle animals like cattle, and they are not as experienced as the male counterpart. So we made them act those roles, and we ended up agreeing that whenever they are going to such places, there's a need to invite their male counterparts to join them in the community they are visiting. So through communication skills, they were able to learn how to communicate to community leaders, religious leaders, and then respected farmers. And this is an example of gender approach in practice. For men that are not allowed to get in touch with female farmers, it's an opportunity also for them where the female VPPs get to interact with the women farmers first before they get to see the male VPPs. So this is an example of gender approach in practice for men actively speaking alongside with women and vice versa. So I will hand over to my colleague, Grace, to tell us about her experience in Uganda. Thank you.
Thank you so much, Dr. Fatima. Another key challenge facing women VPPs is handling large livestock, such as cattle, due to poor animal handling facilities and inadequate training during the initial training in the different training institutions that train these VPPs. We addressed this by adding specific online modules and practical sessions on animal restraints during that training in collaboration with the different training institutions that offered the farms for which we use the animals to demonstrate, as you can see in the photo. To overcome stereotypes and physical barriers, we made sure that female trainers do role model in animal handling to trainees. In the photo you're seeing, I'm demonstrating to this a VPP how to restrain and examine an animal for the different diseases. For example, if you suspected foot and mouth disease. Overall, the practical animal handling sessions were not only technical learning opportunities, but also empowering experiences that contribute to women confidence, visibility, and participation in spaces that are traditionally dominated by men. I want to hand over to you, Emma.
In the beginning of the presentation, I mentioned that a key question we asked ourselves is, how can we better reach and serve women livestock keepers? I'd like to share a quick case study to illustrate this, and this is based on a CGIAR study that was conducted in Uganda, looking at the gender division of labor in pig husbandry. And what it found is that men typically are involved in tasks such as marketing, buying feeds, and arranging veterinary services. And women, on the other hand, were more involved in cleaning, feeding, and watering the pigs. So based on this division of tasks, female farmers are more likely to quickly detect disease, as they're typically in daily contact with the pigs. However, due to gender norms, women are too often excluded from information on how to report or respond to diseases. And this creates weak links in animal health systems. I'll now hand over to my colleague Brian Kabagambe to explain how our training addressed this key gap.
Thank you very much, Emma. Well, we all understand that overlooking women's contributions undermines their potential as change makers, and this overlooks valuable solutions to persistent health challenges at the community level. So how can we prioritize outreach to women livestock keepers? In this regard, we can utilize a gender-responsive animal health service delivery approach, which in simple terms means provision of animal health services in a manner that aims to actively involve everyone involved in livestock keeping activities. So this includes women, men, as well as girls and boys where relevant. Then also in a manner that aims to understand the risks and opportunities associated with each person's role on the farm, and then build their capacity to make informed decisions that can benefit livestock health and production. So in our training program for VPPs, we call this the target, understand, communicate model, where target means, in simple terms, speaking to all members involved in livestock keeping when taking a history, because women, men, girls, and boys all play different roles in livestock management, and therefore advisory services or messages must reach those doing the day-to-day work to ably understand, the dynamics of animal health and production on farm. Then understand in simple terms means asking questions or probing to understand who does what, who decides what. For example, who decides whether to invest in vaccination or treatment, or who needs to know what. Recognizing that division of roles on farm shapes risks and opportunities for disease, prevention. Then communicate basically means using a communication style that is gender sensitive. In other words, tailoring your communication method to the target group while taking into consideration the literacy or the knowledge level And this basically helps one to ably support women and men farmers in making informed decisions. As a trainer, I have seen firsthand how, this approach has helped very many VPPs transition from a fixed approach to animal health service delivery to a more gender sensitive approach. And on screen, you can see one of the testimonies where one VPP said, "The knowledge I acquired from this course, especially the module on gender sensitivity, has made me understand why sometimes I'm not successful in advising farmers on good husbandry and biosecurity because I used to neglect important members of the family. The knowledge from this course will help me reposition myself well in a better way of advising farmer families." So this testimony is evidence on how a gender sensitive approach can ably facilitate solving on farm animal health and production challenges. Thank you very much. Let me invite the next speaker.
Thank you, Brian, and Emma, and Shehu, and Fatima, and Grace, for really helping us understand that we do need to understand that end user. We need to understand their needs and their barriers in order to design better training for the veterinary paraprofessionals that are going to be working with them. These human-centered design elements translated then into practical ways that we adapt our programming. So great explanations for these things. I want to hand it over now to Balaji Afrolaran, who is the VPP project training lead with FAO Nigeria, and will talk to us about the data generation throughout the implementation of this program and what it really told us. So let me hand it over to you, Balaji.
Thank you so much, Julie. And let me start by saying that the need assessment did not end at the point of when we started the delivery of the training courses. In fact, some of the richest and beautiful insight that guided the gender responsive approaches in our training program came from the VPPs who participated in the first phase of our training, our team of trainers, and different training institute at the different training institute across the 3 countries where we have this training, and we keep on the effort to keep learning throughout the delivery cycle. We have collected immediate feedbacks from trainees during each trainee's session in form of informal means of collecting this data through, by using the posters on the walls, and also we added like a short survey at the end of each training. At the end of each training course, we also do what we call the focus group discussions, where we held we did so with both the VPPs and the trainers, and mixed and gender separate groups were used to better understand the experiences and the challenges for women. Also to measure the impact of the training, we looked at 2 levels. The impact, firstly during we measured the impacts on the VPPs themselves, all right, and their livelihoods. Then we also looked at the impact of the training on the farmers that received services from the VPPs that we have trained, and we have presented this result in a separate webinar. My colleagues will share the links to the recordings of these results in the chat box. If you're interested, please do not hesitate to have a look at it. It is very important to highlight that again, that all the data we collected was sex disaggregated. Next slide, please. Yeah, so also important for us to know that, okay, we are going to give two examples of how we adapted the training program based on our learnings from this data gathering effort. One key area of improvement that we identified was in the facilitation skills of trainers, and this is very, very important. Because in the focus group discussion with both the trainers and VPPs, we identified that some of the women VPP trainees were less confident contributing to the interactive classroom discussions that form a key learning modality in the training that we have organized. As part of our trainers capacity development programs, otherwise known as the TOT, Training of Trainers, which supports the trainers from partner institutes in all the 3 project countries. We provided we provided training on inclusive facilitation skills, and we co-developed the strategies with trainers to ensure that everyone, all right, who may be less confident could participate in the training. It's important to note that we discussed overcoming bias that may be the experiences of amongst even trainers and also the trainees as well. So we worked to encourage participation in range of different ways to suit different learning styles, to ensure that those that are similarly timid are able to also participate and also be part of the training fully, and then are able to come out of their shells. And one beautiful thing that we did was what we call the scenario-based role plays, which has proved to be very valuable approach in this training delivery at the end of the day. Next slide, please. So in our second example, we identified in parts in phase 1 that not all our selected trainees were in the ideal business situation or with the needed enthusiasm to benefit most from the training. Many attended the training for so many reasons best known to them. We therefore improved the selection process by adding in a telephone interview, as mentioned earlier, to find out more about the trainees. And this really, really improved the kind of trainees that we're able to get at the end of the day. This, it ensured that the selection is merit-based. Importantly, the phone interviews meant that the quota system that was talked about all the time, for women VPPs participation of 40% in this case in the training is merit-based. All right, so avoiding a risk that women are included as a box ticking exercise, and making sure that we could genuinely and select the best candidate at the end of the day. So these are the things that we're able to do and proved to be very, very useful. Now I will hand over to Emma to give the summary of the lessons learned so far. Over to you, Emma.
So what were our lessons learned and key takeaways from this work? The first one is the importance of sex disaggregated data. And this is because aggregate numbers can mask gender gaps entirely. And breaking down data by sex really lets us see and better understand where and how needs may differ between women and men. The second one relates to gender quotas. From our experience, they work best when paired with proactive outreach and clear eligibility criteria. Accounting for digital gender gaps can really help boost accessibility. Often very simple and small changes can make a big difference in bridging the digital divide. The importance of engaging men as allies. So when men understand and support gender equity goals, this can really amplify sustainable impact. And lastly, and this is a crucial one, is that for us, using our monitoring and evaluation data as a sort of continuous feedback process really helped us to identify what was working well and what needed improvement. And ultimately, this really allowed us to iteratively improve the training model and its impact through evidence-based approaches. Thank you very much.
Thank you, Emma. Thank you, Bolaji. I wanted to invite Jenny. We've had some questions going in the chat. I know we've had responses to those questions. I'm wondering if, Jenny, there's any questions that you'd like to pull out and have one of our presenters answer.
Thanks, Julie. I've been receiving notice that we're a bit short of time, so we've been furiously typing lots of answers to all your questions in the chat, in the Q&A box. I think for time, I will suggest that we encourage everyone to move on to the second session, where we'll have time to have a look in more detail. But I would just advertise for everyone who hasn't looked in the Q&A box yet, there's some great questions there about how we adapted the curriculum, and I think some of those questions were answered as the speakers were going along, so I think I couldn't type as fast as the answers came up from Dr. Fatima and from Grace, and we've had some great questions about the impact assessment work as well. So if you've not had a chance to look at your colleagues' questions in the Q&A, please do so, and then we will try and answer some more by typing, and we'll have lots of opportunity now. We're getting to the informal section where we can discuss in a lot more detail.
Fantastic.
So what
Thank you,
were
Jenny.
our lessons learned and key takeaways from?
Okay, fantastic. Okay, so we're getting ready to move on to our very interactive session. So for this part of the workshop, we want you to please have available a piece of paper or a notebook, a pen. We're going to actually work through some questions together. Feel free to actually go get what you need. We're going to take a quick 5-minute break, and I mean quick. 5-minute break so that everybody can come back and be ready for more engagement. So this next section is less about you receiving information and getting an understanding of the program, and more about you actually thinking about how these lessons and these insights can be used in your context for adaptation of trainings that you are thinking about. So really start to utilize some of the tools and methodologies that the team has used to create this amazing work. So I'm going to give everybody 5 minutes from now. So that means back here by 8 after the hour. Oh, please. Yes, 8 after the hour. And then we'll kick off with this very interactive section. Come back to your computer. Come back and join us. So welcome back to everyone. And for those who are just joining us, we're very glad you decided to join us. We're now going to take the next hour to practically engage with one of these tools. So in our last session, you really heard how these tools are adapted for purpose and context, and how really this collaborative process was part of the reason why these tools have created the results and the impact that they have, right? That essential piece. Now, this is your opportunity to begin to engage with these tools in a somewhat similar way. So in order to make them relevant and reflective of the context that you yourself work in and the teams that you work on. So the FAO team is going to lead us through this process. We want to make sure you're ready. So find your paper and your writing utensil, because we are going to have to write and reflect, create some tables on our sheets. So to do this, we are going to be good practitioners, and we're going to generate a little data to start this adaptation process, because all good adaptation process start with a little data generation. So we've got a poll that we're going to put up. All right, so there's 3 questions you're going to need to answer. Do you currently adapt training and training content based on, based on gender considerations? There goes the poll. It's a yes or no question. Do you currently do this? No shame in saying no. That's why we're here together. And then the second is really, what's your biggest challenge in making training gender inclusive? And you can then select all that apply for you. So let's see what you say. Do you currently do it? And what are your biggest challenges in making training gender inclusive? And you should have a poll that you can respond to. So we need to generate this data.
Just to say, you'll see that there's a little scrolly button at the bottom of the poll box. So you answer the first question and then click the little scrolly button to answer the second question as well.
So everybody do the polls. It's 2 questions. Do you currently adapt training based on
We've
gender
had
considerations?
14 responses so far, and it's about a 50-50 split. Can
Oh,
people see the results on their screens? If you click view poll, the live results are coming in.
okay. Staying at 50-50. That's fantastic. Whoop, we're getting a little more of the yes. That's excellent. And really, this is a mix of all these challenges, right? There is a lack of data. Time and resources are not always allocated. Institutions do have resistance within them to that time and resource allocation in order to actually have the data. And some of us don't know why. Huh? But lack of data, that's big. Data is oftentimes our biggest challenge, and dedicating the time and resources to generating that data.
Yeah, lack of data seems to be winning a bit here. So
Yes.
yeah,
Yes,
and
it
certainly that
does.
was a challenge that we had.
So we do have to generate this data in order to make these adaptations. And this is exciting that we are experiencing barriers that this next session is going to help us start to figure out how to do. So should we give a couple more minutes for the poll, or do we think we're going to close the poll soon, Vanessa?
Maybe we can have people starting already to type. We're after also the question in the chat box. So if you've answered the poll, maybe we can also start typing in the chat box.
So in the chat box, you're looking for how would this methodology for adaptation through gender considerations apply to your work? So that's what's in the chat.
You're going to have lots of chance to do this, but any ideas you have so far about what all my wonderful colleagues have discussed in terms of methodologies that we use, do any of them apply to your own work? And we'd love to hear about that.
The insufficient information, the lack of data.
I mean, we're now at 62% of everybody here is adapting training based on gender considerations. We might have a slightly biased sample here of people joining us in today's meeting.
Absolutely. But very familiar reasons why we have barriers too, right? So how would this methodology apply to your work?
So no need to write an essay in the chat, but any sort of bits that sprung out to you that you thought, oh, that's pertinent to what I'm doing, or, you know, that's something I'm going to take away. We're interested to hear kind of what chimed for you so far in the discussions we've had. If you... Ah, great. There's lots of things popping in now.
Yes.
So difficulties in allocating resources.
Yep. Especially at a
from
government
Ingrid.
level. Yeah.
And Sebastian is talking about, sounds like a really interesting program, a training on ruminant biosecurity in Spain and the UK. And the fact that the target, I think the targets of your training program are the people who should guide the program according to their needs. And you are planning on using focus groups, interviews and workshops. So that's something that we also found very useful and can discuss a bit more today.
Amazing. So if you're continuing to type, please type and put it in the chat. Everybody's reading it. This is a part of our knowledge exchange, how we think this is relevant to our work. And I'd love to invite the FAO team to take us through the exercise on how we might think about adapting in our own contexts. Over to you, Jenny.
Thank you very much, Julie. So the second part of this, you've heard lots of theory, and now we wanted to give you a chance, firstly, to hear from all of you and the work that you're doing, but also for you to think how some of the examples we've shared will apply to you in practice and some of the training you're developing. So this session aims to give you the opportunity to reflect on what you've learned today, apply what we've discussed to your own context, hopefully have a bit of fun and get creative. Don't worry, you don't need to be an amazing artist, as I've used here in the icon. This is very simple creativity, and hopefully some notes that you can take away and use yourself in the future. Next slide, please. So this is where you get to get creative. So hopefully in the break, you've managed to get a piece of paper. It can be big or small. All you need is a paper and a pen. And we want you to draw this simple diagram. So I've done it. You probably can't see on my piece of paper. It doesn't show up very well. But sketch yourself out this very simple diagram as big as you can. So it's got 3 boxes, one for needs assessment, one for how, and one for what. Next slide, please. So just to explain what each of these boxes mean, these are really referring to the sort of 3 categories of things which we've discussed during today's presentation. So needs assessment looks at 2 things really. What are the questions that I need to answer that will help me adapt my training to best meet the needs of my particular learners? And what simple steps could you take to find out the answers to these questions that you have? Then secondly, you've got 2 other boxes. So one is the how. So we talked today about some of the learning methodologies that we use to make sure that everybody could equally benefit from the training. So that's everything from making sure we use smartphones so that women VPPs could access alongside men, to thinking about the timing of the workshops, the location, etc., etc. So how is all about the methodologies. And then what is really about curriculum design. So what knowledge and skills do your learners need to develop themselves through the training? And then what do they, if they're service providers and animal health service providers we're talking today, what do they need to then be able to go out into their communities and do their job in a gender responsive manner? And that's where Brian was talking about the target, understand, communicate approach that we've developed for working with livestock keepers. Next slide, please. And when you start thinking about one, you'll find it links to another. So you start thinking about the how, and that makes you realize, oh, I've got a question that I'd like to find out more in the needs assessment. And when you do your needs assessment, you'll find out lots of information that helps guide you on the how and the what. So although we'll go through these in sequence, all of them are linked together, and that's shown by these arrows here. Next slide, please. So to do this training, we think it will help you if you focus on a specific training you're involved with. So the ideal situation, and I think I can see popping up in the chat some examples of this, is to reflect on a training that you're currently putting together and working on. And certainly we've got colleagues who are doing that. But if that doesn't apply to you, that's absolutely fine. Don't worry. You can use your imagination. So think about a training you might yourself have developed or led in the past, one that you'd love to do in the future, even if it's just a distant dream, but one you'd love to be able to do if you could. Or perhaps if you're not somebody who's directly involved in organising training, perhaps you've taken part in some as a learner, and you can use that to think about how that training could have been better adapted according to gender considerations. So use your imagination and picture a training that's most relevant to you. Next slide, please. So now we're coming to our first box. So we want you actually to start not with the box at the top, the needs assessment, but with the how box. So as I just said, this is where you think using what you already know about the learners for your training. So what do you already know about the learning methodologies that will ensure everybody could equally benefit from the training? So maybe there's been some kind of light bulbs that have gone off for you, that you've sort of thought, oh yes, I'm this training, I hadn't thought that, I need to really consider women's childcare responsibilities and how I can assist with them and to allow them to come to training, for example. So you've got to think about your particular learners and then any practical changes or adaptations you'd make to the methodologies that will allow men and women to participate equally. So that might be modalities, whether it's an online training, is it a face-to-face training, is it combined? When does it take place? How long is it? Where does it take place? If it has a cost element, is it affordable for men and women? We talked a lot about how we've recruited trainees. How are you going to recruit trainees to your training and make it accessible? How will you advertise it? How might you select trainees? Will those trainees need permission to come to your training, and how will you achieve that? And does it have a gender aspect to it? And then the learning modalities themselves. So will women and men learn better from lectures, group work, particular exercises or practical sessions? And Balaji and Grace both gave examples today of how we've adapted our training to include different facilitation skills for our trainers and different types of practical sessions as well. So while you're thinking of this, and you can already start filling in your how box, I'm going to ask my colleague Grace to join us and just talk a bit about some of the hows that we did to make our training more accessible for women VPPs, particularly focusing on our face-to-face training. So next slide, please, and over to you, Grace.
Thank you, Jenny. And this is interesting because from the Q&A, Segaye Negashi was concerned about the cultural norms. From the assessment, as you've already highlighted, one of the findings was that women preferred shorter face-to-face sessions to manage family and work responsibilities. I think this will respond to Negashi's concern. So in response to that, from that finding, the face-to-face sessions were capped at 3 consecutive days to reduce number of days women VPPs are away from their families and work. Then also friendly childhood spaces were provided, which included breastfeeding breaks being built into the training schedules that we had. And also the childcare support was provided. For example, in Uganda, all female VPPs, we requested them to turn up with a child caretaker who we also supported. So you find that in finding number 2, the gender norms and household decision-making, this also affected the women's ability to commit to the training. Here, some spouses were reluctant to support long training absence, and the majority were concerned about women being away or overstudying. So to address this, the team developed a family welcome package, which was sent directly to the VPPs and their households, including the following. In that package, we had a detailed training schedule that clearly highlighted the number of days and what we were going to be handling. And then also the same package contained anticipated benefits of participation at different levels. For example, at the individual level, household and community level. And also, we sent in, within the same package, we had an explicit request for spousal support, understanding, and buying in, so that when their spouses left their homes, they were okay with that, and this helped us to have their other spouses at home at peace when the female counterparts left for the training. So we also, in the same package, guided on how the different roles will be redistributed at home during the training. So that really is one way of how we dealt with the norms, the cultural norms at the different VPP families. And also this informed our blended training. The hours were reduced. As you can see, we had 90 hours mobile first tutored online learning, and the 4 workshops that were reduced to 3 days each. And all that was designed to fit around VPP's businesses and family commitments. I hand over back to you, Jenny.
Thank you, Grace. I hope that's been an inspiring example for all of you on some of the things we did with learning modalities. And it's now over to you. So if we move to the next slide, I think we're just going to give you 2 minutes actually rather than 3. We've got some lovely musical accompaniment again. So this is really where we want you to make some notes. So I've put back up here on the screen, but in your how box, just drop some ideas into that box on how you might adapt your training to make sure everybody equally benefits from it. And there's some prompts there. So we'll give you just a couple of minutes to make sure we keep to time.
Time's up.
Great. So we've finished our how, and if you're still scribbling, you can still scribble a bit while we're moving on now to look at the next one. So if we move to the next slide, we're now looking at our what box. This is now thinking, instead of how you're going to do the training, effectively what you want your learners to learn. So what knowledge and skills do your learners need to develop through the training? And really then, so this may be some skills they personally need, or ones that they particularly need to do their job, and to do that in a gender responsive manner. And there I'm thinking about examples such as making sure that they can reach out equally to men and women livestock farmers. So have a think really here about what particular knowledge or skills do your learners need, perhaps to overcome gender bias in their work, to provide services to clients who are experiencing gender differences or biases, and have a think about whether there are any particular gender related differences in current skill levels. An example we had was the relative lower confidence levels that female VPPs had in handling large animals. So to give us an example of this, I want you to already start thinking and noting down on this, but we're very lucky to be joined by a colleague, Ashima Alplish. Ashima is a veterinary officer for the Australian Department of Agriculture. She's previously worked with us in FAO, but she's been busy supporting animal health capacity building in Timor-Leste and Papua New Guinea. And she's been using kind of adapting training that's been done before to that new context, and she's going to share some experiences of that. So we'll move to the next slide, and over to you, Ashima. Thank you for joining us.
Thanks so much for that intro, Jenny, and thanks for inviting me to briefly share how some of the approaches that were developed through the VPP project have actually been successfully adapted in the Indo-Pacific context in which I now work. Like many of the contexts I'm sure we all work in Timor-Leste, gender impacts not only the exposure risks, and that's often through a gender division of labour, but also disease management on farms. So through many discussions and observations with the Timorese animal health teams that I now work with, I quickly realised that this was a commonly under-recognised and understood concept. And so it was something that needed to be introduced through our training opportunities. So we actually used the Target, Understand and Communicate framework, which was introduced earlier by Brian, and you can see in the slide, or the photo on the slide now, to support animal health workers in Timor-Leste to take a gender responsive approach when communicating specifically about brucellosis in cattle. And so what we really found is using this sort of simple and practical model like the Target, Understand and Communicate framework, was key to gently but also effectively introduce some of these newer concepts around gender. And that was able to be done in a way that was contextual, it was accessible, but it was also easy to apply for the animal health workers in their day-to-day interactions with households and farmers. But that's specifically without being too prescriptive. And so just really briefly, in the setting of Timor-Leste, the framework was really useful to highlight the importance of sort of 3 different things. And that was one, to involve all household members in conversations about brucellosis, especially in a context like Timor-Leste, where there are strong gender hierarchies and community norms, especially when it comes to farming of large livestock like cattle. The second was that it enabled the animal health workers to understand the different roles that men and women play in livestock management and in biosecurity decisions. And so, for instance, in Timor-Leste, placenta is actually commonly consumed and women are responsible for the cooking process. But men, on the other hand, deal with things like calvings, and they make decisions about vaccination and whether cattle, particularly cattle that have perhaps recently aborted, are kept in the herd, or they may be sold or slaughtered. And the third thing that the model was really useful to reinforce was that all household members may actually be at risk, therefore, of exposure. And it really showed why that clear and sensitive communication is quite central to delivering both effective but also inclusive animal health services. So thanks, Jenny. It's just a little bit of a snapshot of what we've done in that region. I'll pass it back to you.
Very much, Ashma. That's a great example of how the same tool can be adapted to different communities, as long as you take a really careful step first to really understand the gender context in that community. So now I'm going to move to the next slide, and it's back over to you. And we'll just give, I think, 1.5 minutes of music this time, just to keep on track. But now I want you to make some notes about the what in the training that you're imagining. So what knowledge and skills do your learners need to develop through your training? And what do they need to be able to do their job in a gender responsive manner? And where is there perhaps a gender element to that you need to consider? So 1.5 minutes on that. Over to you. And
Time's up.
thank you very much, Vanessa. So I hope you've all had a think now about the what. Now we're moving back up to the top one, because I imagine if we move to the next slide, thinking about the how and the what has led you to realise that there are maybe some gaps in your current knowledge of the needs of your learners, and particularly the gender related needs of your learners. So perhaps while you've been thinking about what currently the gender needs are in terms of how and what, you know some things, but you'd like to find out some more. So we suggest that you do this by thinking really in 2 stages. The first is, what questions do I need to answer to adapt my training to best meet the needs of both men and women learners? And once you've found some questions, you need to think about how you can find out the answers to those questions. Next slide, please. So when you're thinking about some of the questions you might have, here, just jot down any questions that really come to mind. But, perhaps are there differences in access to some of the technologies you would like to use for your training? Are there differences in the precursor knowledge, skills or experiences that men and women trainees might have? Are there differences in some of the practicalities to attend the training? And we talked about that in methodologies. Are there differences in the ability after the training to apply the learning? So an example of that might be our colleagues in Nigeria who might have faced challenges in accessing some livestock communities. Are there differences in the situation, gender differences in the situations of the clients who your learners will provide services to? So what do you know about the needs of farmers, if those are the clients? And what more might you like to find out so that you can make sure your learners are learning things that best meet the needs of those farmers? So that's just some examples. I'm sure you'll have other questions, but those are some things you might note down. Next slide. And I think here we come to the thing that all of you said was the hardest thing to guide you, which is really data. So how can you find out the answers to these questions? And I think one of the things that I hope came across from all my colleagues' presentations today is that while sometimes you do need to do big surveys and big studies, you can also find a lot of things out relatively quickly and easily. And one of the first of those routes is by discussing with colleagues with similar experience to you, perhaps in the same context or a different context. You can also relatively quickly and easily identify some important key informants who can give you a lot more information, or consult existing resources and literature. And those are all low cost, quick and easy things to do. You may also then want to go further, and we've certainly found it incredibly valuable to use both surveys and focus group discussions to guide us before we did the training, and as Balaji mentioned, throughout its implementation. I'm sure Emma would highlight really importantly how important it is to disaggregate the data by gender and to cross-reference between different sources of information to check that your findings all add up. So next slide, please. So really here, I'm just giving a very simple example that we did from our project. So I'd suggest you sort of have two sides to your needs assessment box. And on one side, note down some questions. So here, a question we had was, are men and women VPPs able to study online? And can they access smartphones? Can they access laptops? And Emma mentioned that in the presentation earlier. And then what opportunities did we have to answer that question? So the first thing we did was ask some key informants, so some colleagues that we know work closely with VPPs or some VPPs themselves, to ask their opinion on this and look at the existing literature to guide us. Then we did our surveys, and as Emma mentioned, something we wanted to highlight here is you do have to be careful not to bias with your survey modality. And a great example of this was we actually phoned VPPs up. We did a telephone survey because we thought it wasn't very good to ask to do an online survey to find out about access to the internet and smartphones, which would have obviously been a huge bias. So that's just something to consider. So I think if we move to the next slide, your final short musical interlude. Again, I think we'll just do 1.5 minutes if that's okay. Thanks very much, Vanessa, and thanks everyone. I hope you've been busy filling in your piece of paper. So we'll now move to the next slide. And we're really now coming to the part where we want the most interaction from you. So we'd like you, and I've been following all the discussions so far in the chat. So this is where we'd really like to hear a bit more from you. So we'd like you to have a look through your completed diagram and have a think about what you've learned during this very quick process of thinking about how to adapt your training course. And we'd like you to pick out the 3 most important changes you will make to your plans for the training or the imaginary training you've been thinking about based on what you've just learned. And just really quickly, as we're talking here, drop these changes in the chat box. There's no right or wrong answers here, and your changes can be big or small. And no need even to put, all 3 at once. We'd just love to see some learnings popping up about some ideas you've had about changes, big or small, that you'd make to the training that you're planning on the basis of what you've learned today. So I'm just going to start having a look at these popping up now. While more of them appear in the chat, and I think Julie, I'd probably appreciate your help to have a look through some of these as well.
I mean, I think it really resonates that engaging colleagues and resource persons, right? You don't have to always generate data with participants, with community members, like really checking in with your colleagues and the different resources on your team. That resonates quite a bit.
Definitely. There's a great one here from Andreas talking about language. So making sure you adapt the language of the training to the local context and its variations, and that makes you feel more comfortable. And that's absolutely true. I think we went even beyond that. It's not only language, it's also photographs, for example, making sure that the photographs or the diagram are from the particular context that people are in. It makes you feel more comfortable that this training is for me. And actually some of the feedback we had where we hadn't been able to do that so well in our online learning, we had feedback from VPP saying, I'm in Uganda, and why do I see a picture of a VPP in Nigeria? So that's a great one, Andrea.
And Tazagai's comment a little bit earlier, I think, speaks to some of these types of adaptations, right? And really thinking about the childcare aspects and the flexible schedules and the venues, right? So some of these learning pieces that we're thinking about when we start to make these training adaptations. And requests for the slides. This is there have been multiple. People are excited about the slides. It's all training material.
And they will all be set. A recording will be shared with you afterwards.
So what are some of the other adaptations you wrote down on your paper? What are some of the other things you're thinking on the how of your training modalities, how you do your needs assessment, slightly different, that what side of things? So really reflecting on where you want your participants to get, and are there gender barriers to that, or are there gender dynamics to those objectives? So other ideas when you're doing your workshopping.
So there's some lovely ones here. So Martin's saying, have I done enough of a survey and searched the key have I looked for enough information? And it would be important to engage colleagues to look for that key information. So I think I hope that kind of needs assessment and the value we found in that sounds like that would be really useful for you, Martin.
And Dennis is really saying, make sure those women are in leadership roles in this process, right? So including participants where you can, and or female VPPs, right? You'll have early adopters. You'll have people who are really excited about doing this with you, right? So seeing mentoring in a slightly more collaborative light.
Definitely. Stella's got a lovely one, engaging men as supportive partners and leveraging traditional and religious leaders to give platforms for women. And I think that's something, again, it depends very, very much on the particular context in that particular community, but it's something that, as Dr. Fatima was saying, we found really, really valuable. She's still here, so I'm sure she'll be welcome to chime in if she'd like to add anything on that.
And Jay has a great comment here around just timing of the year, right? Our festival's happening. Jay speaking to do trainings in lean season, right? When you can get access to people when people are doing less things. Really great comments.
One from Ashima, more practical components like role play. We love role plays. They've been the most popular parts of our training, and I think they're genuinely useful that you've done a role play, and it makes it a bit easier when you do that thing in real life, and they're great fun during the training as well, which tends to mean that the things you learn stick if you have fun while you're doing it.
Tezagai is chiming in again here and really thinking about what is available locally to help you do your training, right? So not planning trainings around using mobile tools or using the internet when that is not accessible, but really that alignment of access to resources and capacity with the target communities that you're working with, as well as the cultural norms.
And I think then we've got, a really nice one, understanding the communication of the community that where you are and collaborating with colleagues. And I think that's something, I hope that's something, maybe I can, Julie, advertise the LD4D network. But one reason we wanted to do this webinar is we've learned some things here, but we know all of you listening probably have learned other things. And it's a great opportunity to say, we tried this, it didn't work, but then we tried this and it did. And I'd really, we're certainly very happy to hear from anyone here. And I think colleagues can be really useful for good ideas in developing this kind of training.
Absolutely. And I think it's a great note in the chat that properly engaging those gatekeepers, as far as thinking about them in the how and in the what. So not just thinking about the participants, but who are the gatekeepers around those participants you are trying to engage, and how do you engage them? You know, the packet for the family that really explained what was happening, and why it was important to the family, you know, reflecting on what are those resources that you need to get buy-in from those who will either make it easier or harder for you to engage the community members you want to engage. All really, really important. Thank you, everyone. And it's really exciting to have so many people stay and participate in the second part of the session, as a network and as a community that is really trying to drive practice adaptation and change, and not only learn from each other, but really do some of that capacity strengthening work that is sometimes just a like, take me through the thinking process. We really appreciate you coming and doing the work of doing the thinking process together and collaborating with us on this. We are aiming to do more workshops that are like this, where if there is a tool that's being introduced or has been utilized, that we can really work with the teams to take people through different aspects of them. So with that, I would love to thank everybody who's been involved with this. Amazing speakers. There's been so many in the past 2 hours, and I'll hand over to Jenny to do the final acknowledgements. Over to you, Jenny.
Thank you. And it's, well, I don't worry, I'm not going to read all these names out, but as you can see, there was a team of many presenting today. And behind there are many more. So we wanted to flash this up just to point out what a big team it is that have worked on different aspects of this program, and particularly to thank the most important people, which are the VPPs, their mentors, and the farmers that they work with, and the Gates Foundation, who have generously funded this work. So I hope there's even more names than are here, but thank you to everybody, particularly those who've contributed their experience today.
And like any good webinar and good data practitioners, we need to generate a little more data at the very end of this webinar. So we will be putting up a poll for you all. Please do it. It always helps us continue to improve. I mean, some of the reasons why we are doing these more adapted webinars that are more engaged and kind of verge on that capacity strengthening and thinking together is because of the feedback that you all give. So please do take the time. It is very quick. And fill out our rapid poll. And with that, I'll thank you all for taking the time. 2 hours is a commitment. Our time is valuable. Your time is valuable. And to choose to spend it with us learning is a privilege. So thank you all for spending that time and for doing the work.
Thank you very much. And I think maybe from our side as the team, you know, do reach out. We'd love to hear from you, and we'd love to share more experiences. So if something's perked up your interest, then we'd love to hear more from you as we're filling in the chat, and we've tried our best to answer your questions, but if there's more questions we can answer, please do drop us a message. I will just drop my email address in the chat, and that will get you through to most of the team you've met today.